Hello, welcome to Ask Giri, the Physio Show, third episode. The topic of today's episode is how hip is your hip. We're going to discuss about how we are abusing the hip in our lifestyle, then how to take care of them, and how to make sure that it's moving well without pain. That's what we're going to talk about today in this episode. Join us to enjoy this and give us your feedback and comments after watching this episode. Our lifestyle and our hip. How are we abusing our hips in our lifestyle? First of all, the first and foremost thing is sitting. We do too much of sitting, right? From the time we wake up till go to bed, we sit and eat, we sit and drive, we sit at work, lots of sitting. We are just using our hip in static position for a long time, and that's not helping your extension movement, which is this movement of your hip, too much at all. And your gluteus maximus, the big propellus in the back, is not being used very well at all. And also, in our lifestyles, we do not use our hip range of motion that well. We don't rotate that well. We don't take our legs to the sides much. Even flexion, when you're sitting about 80 to 90 degrees of flexion. Your hip range is about 130 to 135 degrees of flexion. The last 50 degrees of flexion is never being used at all. So your joint does not get the full range. It doesn't do that massage inside for the synovial fluid, your joint fluid, to go around the joint and feed the cartilage well. That's why we see so much problems of osteoarthritis in the hip, because the hip is underutilized. And sometimes then you compensate, then you start loading them too much, then you get wear and tear in the joint. That's the main thing. And a lot of biomechanical dysfunction on the hip, because somebody else is not doing the work, then hip has to do more. Sometimes the hip is not doing enough work, somebody else has to do more. Those are the common things. So what are the most common causes for the hip pain in our general lifestyle? Is osteoarthritis is number one, which is the wear and tear of the cartilage because of the loading or abnormal loading or overloading. And also mainly you have sometimes you can have impingement. The cartilage on top of the hip joint can tear. You can have femoroacetabular impingement, we call it. You can have that. You can have internal derangement, they call it. Something is not right inside the joint. It can be a sports problem, sports issues, and also biomechanical issues. Any of this can happen in your hips. And also hip is connected to a lot of other parts of our body. Is important. Your body weight is going through the hips, right? So 50% of the body weight through this hip and 50% through this hip. And it has to go through your hips. Your kind of a tailbone, then goes to your sacroiliac joint, and then the hips and down to the legs. So it's a very important transfer junction of your weight bearing as well. And hips are also the foundation of your spine. So if you see your spine, your pelvis is here and your hip joints are right here, right? So this is your foundation. If the foundation is not stable, the spine cannot work very well. So it has so much relationship between the hip, the tailbone, and the lower back spine or the whole spine, right? That's very important. And also the tailbone here, the rotation of the tailbone is also important. The tailbone rotates to the right, then the spine rotates to the left. There are movements connected there too. And that's closely connected to the hip through ligaments and the muscular connections. So this complex is very important for you to have a good foundation and stability, and the transfer of load from the upper and the trunk into the lower extremities during walking, running, or any kind of sports, lunging, squatting, reaching, any kind of activities. That's why this area is very, very important to take care of. And also the hip is very important for the feet. The posture starts and ends in the feet. We discussed that in the last episode. But hip alignment, mobility, and the stability is important to place your feet in such a position so that you can have a good stance and good foundation to walk upon or to stand upon. And hip is also important because there is connection between hip and the shoulders. Don't forget that. And there's a muscle which is called latissimus dorsi, connecting from the back of the shoulder, which is your arm bone, all the way to your pelvic crest, And so there's connection between there too. If your pelvis and hip is not working, it can affect your shoulder blade and the shoulder movement as well. So it's so much regional interdependence is there with the hip. That's why we chose this topic today to discuss. Okay, we're going to discuss now what are the things to check in your hip. 3 things: mobility, stability, and symmetry. So how to check your mobility and what you can do to improve it, how can check your stability, what to do to improve it, and then symmetry kind of symmetrical mobility and symmetrical stability, also on symmetrical muscle firing. We're going to talk about that as well. To help me with that, we have our Anu here, my physiotherapy assistant, and she's going to help us to kind of see what we're going to do now. First, how to check your mobility. So mobility you can check in non-weight bearing position, so just freely moving your legs and how it is, and also in weight bearing position. So we're going to talk about non-weight bearing position first, okay? Anu, stand nice and tall. Make sure, first in standing itself, a lot of people what they would understand is appreciate and be aware that you're putting equal weight on both sides first. You know how many people I have to correct in the clinic that they overload one side more than the other side. And when you stand, close your eyes and aware where your feet, or where your weight is going on your feet. Close your eyes, Anu. Do you think your weight bearing okay or equally on both sides? Okay, can you feel that? If not, just adjust it a little bit. Good. And also make sure you can open your eyes. And also make sure that in your feet the weight is going in the tripod, okay? Bit on the heel, bit on the front of the big toe, bit on the outside of the small toe. That tripod area we talked about in the feet episode. And that also very important. Just standing and properly weight bearing itself is a good beginning and good start. Okay. Now, I would like to bring you, we're going to check now Anu's right hip mobility. Anu, I want you to bring your right hip up as high as you can and bring it up. Okay, to stabilize, she's helping herself a little bit. She can go up to 130 degree. Any pain there? No, bring it down. Okay, now turn to the side, Anu, face that way, and then try to go back. So this is the most important movement. A lot of people we see, 40 plus, cannot do proper extension, hip extension is quite affected because especially the people who sit all day for work, hip extension is very affected there. Even for Anu, I can see the left hip extension is not as good as the right hip extension there. Okay, that's extension movement. Then I want you to show the abduction, Anu. Abduction movement by the side. In our functional activities, we don't do much abduction at all. Because we don't walk sideways, we don't kick anybody sideways, and that is an underused muscle. So you have to use it, you have to do some side lunges and things like that, some activities like that. And then let's show the rotation. Come up, and I want you to rotate your hip internally and externally. Yeah, that's internal rotation, and then the other way, that's external rotation. Very good. And a lot of people in this movement, you can also lie on your tummy and try to do the same thing, and you can check how symmetrical your rotation is. A lot of times there will be asymmetry in that rotation. That can be due to also joint restriction and also the piriformis tightness as well. And piriformis tightness will not allow you to go out too much in that area as well. So those are the things you can check by non-weight bearing position. In the weight bearing position, how the hip is moving, that also we have to check. The great thing to do for that is our full squat. Okay, I'm going to ask Anu to do a full squat using your hips, not much, using the trunk too much. Yeah, good job. So that full squat, now your hip is about 135 to 140 degrees of flexion there. She's comfortably sitting there. You should be able to squat there. Squatting is a resting position, and not a lot of people can do that. Our goal in the clinic is how many people we made them do full squat in a week, and we're getting very successful in that count right now. A lot of people have a fear of squatting full. They think they're going to hurt their back or the knees or the feet, but it's a great functional position. Not only in squatting, and see if you can squat and reach forward, reach sideways, you know, and see you're able to sustain that stability. Good. And reach high up above your shoulder. Yeah, those things. Okay, good. You can come up now. Thank you. So squatting is a very good test for that weight bearing mobility and how it is moving in your hip joints, and also the other joints are working here too, because we are talking about hip, we are focusing more on the hip here, right? So now we're going to also talk about, see if you can do, let's do a 90-90 and see if you can take your hip, right hip in the front. Very good, 90 degrees, very good. The other one 90, and if you can maintain that stability there. So this is 90-90 position to check how your hips can move and rotate very well. Now switch the other way, Anu. Great job, 90-90, good. This is a great position to move your hip in the way you can move. If you're sitting all day in the chair, these are some of the things you can do actually to help your hip to move better as well. Next we're going to show, you can relax from there at all. Okay, now we can see some lunges. You can come up and show a couple of lunges and see how the knee is flexing, hip is flexing here in the front and then extending there a little bit and then come up and switch. So these are the different ways to check that weight bearing mobility. Good, that's very good. Okay, thank you. So these are some things you can self-check by your own. Make sure you are in safe environment. Make sure that you are able to do these things. If you have a lot of pain in your hip, please consult your physiotherapists or other healthcare practitioners before attempting these things. I don't want you to do something like this and increase your pain and things like that. This is for the people without a lot of hip pain so that they can check on them and see how they are. They can prevent a lot of hip dysfunction for the later day as well. And please be careful with your painful hip. If you have a lot of pain and if it's increasing the pain, please don't try this at home. Otherwise, you can play with it and see how you can do this at home. So that's all about mobility. Okay, now we're going to talk about stability. How to quickly check stability. There's a lot of different ways to check stability, but how to check it in the home environment. Then also I'll show you about how to check with some functional movement screening equipments as well. So Anu's here again to help us. So Anu, I want you to keep your hands on the waist there. Try to bring your right knee up about 90 degrees. I'm checking right now how stable she is on the left hip. Okay, this is the left hip stability check. I'm going to see how she's breathing. Make sure breathing is very important. You don't want to have a dysfunctional breathing pattern. The breathing should be from your tummy. Okay, you don't want a lot of chest things there. And I'm seeing any compensation she's doing in her neck or the shoulders, or she's rotating, or she's dropping, or she's hyperextending her knee, or the foot turning out. So all those things I'm scanning here from top to bottom. Good job, you're pretty good there. This is for the static stability. Now try the other side. And a lot of people cannot do this. You try it at home, be safe, don't fall and break your nose or head. This is very important and a lot of people cannot do this. That's why we don't put our socks and stuff like that in standing anymore. We always run for the chair to do that, right? So, pretty good, Anu, thank you. Now, we're going to check dynamic stability. We're going to do the same thing again. And now, we're going to try to do a single leg squat. As much as shallow, not too deep. And then come up. I'm watching her, how she's doing, any compensations, upper body, lower body, and everything. So the feet is a little wobbly, other than it's fine. Try the other side. Yeah. I can see a little bit wobbliness in the feet. Knee is not caving in too much. That's another good thing. And she's not compensating much on the top. Very good. Good. Nice job. So that is the dynamic stability check. There are simple things you can do at home. And the clinical setup, we also use something called functional movement screening checkups for the hip stability as well. So I'm going to show you guys a couple of stability checks, what we do in the clinical setup. So in our clinic, most of our clinicians are functional movement screen. We shortly call as FMS certified and also SFMA, selective functional movement assessment certified. These systems really change the way we practice and we assess and treat. Developed by Gray Cook down in South in the US, right? So we also incorporate that quite a bit in our patient treatments and evaluation, screening and treatments. So I'm going to show here with Anu how we also screen the hip stability. It's not purely hip, it's hip, knee, ankle, but mostly hip stability during the functional movement screen as well. First thing what we're going to do is called hurdle step. Hurdle step is mainly nothing but an exaggerated walking pattern. Okay, we're going to put the pole behind and just make sure don't pull that too much. Okay, 90-90 kind of things. I want you to come closer and see if you can take your right leg and pass the string and then put your heel down and then go back. So I'm seeing what are the compensations she's doing on the top as well, and try the other side. She rotated back a little bit on the left side. Good, that's a decent one because this is up to her tibial tuberosity and the height we have about 19 inches here for her. That's a hurdle step and she did it very easily, but a lot of our patients cannot do that smooth. Either they will drop, that means they drop, the pelvic might drop, and they will rotate, they cannot balance themselves, and this is another good test for the stability as well. Next I'm going to show you guys squat. The squatting pattern, overhead squatting pattern we call it. So she's going to stand with the heel on top of that shoulder width apart and the pole on top of your middle of the head there. Good, straight up, good. This overhead squat is it's different because it stretches your myofascial slings differently. So doing a full squat without bending too much forward is a different story when you do that. Try that. Okay, as much as you can. Very good. Nice breathing. You're not breathing very well. Good. And then come up. Very nice. One more. Very nice. Okay, come up. So I'm not going to get into the details of scoring these things. We score in 3, 2, 1 patterns, and we do a total score. That's a total FMS screening. We're not getting into that right now. I'm just showing the examples of hip stability testing. And the next thing is called inline lunge, and that's something can be very challenging for a lot of people. That's to check the whole hip, knee, ankle stability. And we're going to put the toe on 0 and your heel on 19. Good. And we will take that pole behind you. 3 points of contact. Back of the head, shoulder blade, and the tailbone. And then see if she can take the knee. It's almost like a split squat. It's not even a lunge, but we call it inline lunge. Okay, very good. Not a lot of compensation here. Now switch legs and do it. So these are the different ways of checking hip stability. Good, let's keep that heel a little bit straighter. There you go. Good. Yeah. It's a little hard, isn't it? Yeah. Okay, put it back. The opposite hand comes up. Head, shoulder blade, tailbone, and then go for it. Good job. And make sure the knee, see if you can touch the knee onto the board. Very good. That's a good job. That's pretty good actually. Thank you. So these are the different ways to check a little bit of stability as well. That's much more complex dynamic ways of checking stability as well, and that we do it in the athletic population, sports specific, and not for the general population. We discussed about how to check mobility and how to check stability and stuff like that. Now we're going to see how to check if your firing sequences are symmetrical on both sides and the sequences are not going everywhere when you try to do an extension sequence or abduction sequence in your hips. So I'm going to kind of show you guys gently just the extension sequence first with Anu. So Anu, can you lie on your tummy for me? So because the right side is close to the camera, we're going to check on the right side. So what I'm going to ask Anu to do is I'm going to ask Anu to extend her hip. That means lift the leg off the bed on the right side. But what I'm looking for here is, let it go Anu. This is what she's going to do. What I'm looking for here is on what sequence the muscles are firing here. We know what the normal sequence is. Normally when you try to lift the leg up there, the first sequence is either the glutes or hamstring has to contract first, and then your opposite side lumbar extensors, that's the third one to fire, and then your same side lumbar extensors, then the opposite side thoracolumbar extensors, and then the same side thoracolumbar extensors. That's a normal sequence. Kind of 1, 1, 2, 3, 4, 5, 6. I'm going to see how Anu is firing. I never assessed her before for this firing sequence. I'm just going to check. So Anu, do I have your permission to palpate your thigh and the glutes?
Sure.
Okay. So I want you to lift this leg up for me. Hold on, come back down again. Okay, lift it up. Go down. One more time. Good, let it go. So I can see Anu actually hamstring dominant. She is contracting the hamstring quite a bit before she activates the glutes. A lot of people have this hamstring dominance because of various reasons why hamstring is over dominant, because even in the normal functional activities, glutes does not fire very well. That's why hamstring overtakes. Sometimes the connection between psoas major and iliacus also to hamstrings. We don't want to get into the muscle sling patterns right now, but this is one common thing we see. Now we determine out of these two, we know that Anu is firing a hamstring first. Now I'm going to check how she's doing in terms of her glutes and the paraspinals here. Okay. So hold on there. Hold on, let me palpate first. Okay, I'm just going to keep both my hands here. Go down, go down. Okay, again go. Go down. Beautiful. All the way down. Relax, take a nice breath. Go again. Good. So, very good. Actually, she contracted her opposite side lumbar extensors first and then this side here. So that sequence is very good there. So far, I'm happy with the sequence. So these are the ways you check and how the firing sequences are. A lot of people have abnormal firing sequences. This is for the extension pattern. Next, we're going to check for the abduction pattern. Anu, if you can lie on your left side lying, I'm going to go to the behind you. Right side lying maybe. Yeah. Good. So we're going to check her abduction sequence. For the hip abduction sequence, we want her to fire her gluteus medius first, and then we talk about tensor fasciae later in the front. That has to fire next, and the third one, her QL, quadratus lumborum. That's a normal sequence for the firing. Now we're going to see how Anu is going to do. Anu, straighten your both your legs straight, one on top of each other. A little bit not rotation. Everything is good. So I'm going to palpate your TFL with my fingers and your gluteus medius with my thumb, and then I'm going to put my right hand on top of your quadratus lumborum muscle. Okay. Now I want you to lift your leg up for me. Good. Go down. Okay. One more time. Down. So Anu has a different firing sequence here. She started with her TFL, it's a tensor fascial lata muscle, and then the QL, then the gluteus medius. Gluteus medius is actually not very activated very much at all with Anu. She was using her quite dominant on the TFL and quadratus lumborum. Gluteus medius is kind of under firing quite a bit. So that is not a right sequence. So I had to work with Anu to work on the right sequence, which is your gluteus medius, TFL, and this thing. So this is very important. You can sit up, and thank you. This is very important for us to have proper firing pattern in all these things, because when you do functional activities, these firing patterns helps really well, and also activates the stabilizers and the core muscles very well. Core, we are not going to get into that too much right now, because I'm going to do a separate episode just on the core as coming up maybe next month. So we don't go into that much now. So core is not just here, right? So your diaphragm has to work very good with your pelvic floor. Your pelvic floor is connected very well with your hip muscles through fascia and also the ligaments. Both slings have to work very well. The abdomen's in the front and in the back muscles, everything has to work very well to maintain the proper intra-abdominal pressure and the core to work the hip as well. So we will see the relationship of the core and the hip later in the core class. Okay, so that is the conclusion of checking the symmetrical firing pattern. So we finished mobility, stability, and symmetrical firing pattern. Going forward, we're going to talk about what are the few things you can do to improve your mobility, stability, and firing patterns at your home. But it's not a prescription. You have to get assessed by your healthcare practitioner and then find out what really the problem is. Then you got to get the root cause of the problem. Then you got to do the appropriate mobility, stability, motor control, or corrective exercises based on what is a missing link in your body. How to take care of your mobility, stability, and symmetrical firing. Mobility we already talked about. If you're sitting and working for a long time, and just get up and move your hips in different ways, forward, backward, sideways, rotated. And also I told you about squatting as a great mobility drill. Try to go for a squat, whatever you can do. Try to be at the squat. And also we demonstrated the 90-90 as well with the hips. And also cross-leg sitting on the floor. If you're watching TV, get off the couch, sit on the floor in different positions. Use to move your hips in different ways. That's what we want from you guys. And the next one is stability, right? For stability, we're going to show you some couple of things, exercises, what you can do. And also, and the symmetry, the same thing works on the symmetry and firing as well. I'm going to show you something to work the hip in the neurodevelopmental sequence, the way we grew up from birth to walking, right? That's the neurodevelopmental sequence. We're going to see how we can take care of the hip in the neurodevelopmental sequence. And the one important thing always, if people cannot walk properly or extend properly, the extension sequence or the extension firing pattern is not great. I usually start them from rolling. And you may be, what, you want me to roll? Yes, I want you to roll. Anu is going to show how to roll from the tummy to the back. I'm going to watch how is the rolling pattern, and I'm going to see, I'm going to help you to kind of do it at home as well. Anu, I want you to go on your tummy for me. Let's put your head this way, yeah. Okay, hands apart and then legs apart. So I'm going to make Anu roll from tummy to onto her back. We're going to roll to your left, Anu. Okay? So I'm not going to cue her anything. I'm just going to see how she's rolling. Anu, can you roll to your back? Okay. Now you push with your hand to roll to the other side. No pushing. Okay, let's come back again. And without pushing, I want you to roll. Yeah. Good. She did start with the hip extension and she rolled to the other side. Let's see. I'm going to exaggerate that rolling pattern. Come back again. Okay. And we want this to come up nicely along with her hands, but she extended her hip, but not that much. So I want her to extend really good, and then there you go. Stop right there. Stop right there. And put this hand up there too, because this has to come up, right? So this is kind of a mid position from rolling. Look at the rotation component there. Look at the combination of the slings here. The glutes from there attached to the latissimus dorsi muscle here. The sling goes all the way. She's using that sling and activating the glutes. Now you go back. There you go. So that's where I start from rolling, because rolling is very important, and from prone to supine you activate the extension patterns. Okay. Now come on to all fours for me, Anu. Hands and knees. So from rolling, baby first gets the neck control. Rolls to the from supine to sidelines and prone, and then baby comes on to the prone on elbows. Then baby comes on to the hands and knees. That's where Anu is at. It's called quadruped position or hands on knees position. And here also you can do some drills for the hip. And I want you, we call it a bird dog. I want you to extend your right hip for me and make sure the pelvis is all square. You can keep a book or a ruler here so that they're not tilting too much. This is just the leg component here. She's coming up to neutral right now. I'm going to show her to extend more. There, that's extension. I want you to extend that much without arching too much in here. Don't arch your lower back too much. And we can repeat it on both sides. Once you get better at this, you can also activate the upper limb also. You can get that sling going there. Good. You can also do this posterior sling, this glutes to this latissimus dorsi, increasing the tension in the thoracolumbar fascia. That increase in tension in the thoracolumbar fascia is very important for the intersegmental stability in your lower back. We can talk about more about that in the core class. Okay. So that's what we're going to work on in the quadruped position. Then come on to the kneeling position for me. Okay, in kneeling position you can do a lot of things. I'm going to let Anu to chop, hold your hands together, and I want you to chop from the left to the right. So you can hold a dumbbell or a medicine ball, or you can use the band or a tubing or a cable systems in the gym. You can do all these chop positions in the knee, in the kneeling position. Okay, now come to half kneeling. You can do the same things again in half kneeling. Half kneeling is a great position for stability exercises. We do a lot of exercises in the half kneeling, and a lot of people first cannot be in half kneeling. You have to stabilize first before you start moving. Now show some chops for me in the half kneeling. Anu, some chop exercises with the medicine ball, dumbbell, whatever you want, slings, tubes, and make sure the foot is not out too much. It's only one fist away from the knee, and then watch for the compensations and breathing, and try the other side. Good. Great. Very good. And also you can do rotations as well in half kneeling. Yeah, good. Yeah. Good. Relax there. And also we can play a game in how stable you are, like trying to be in half kneeling, and people can disturb your stability and balance and see how stable you can maintain that area on all the directions we can see as well. You can stand up now. And in standing we can do lunges, right? Forward lunges, side lunges. You can do that on the stable surfaces. To progress that, you can do the same thing in standing, forward lunges, side lunges, and squats on different objects like a Bosu ball or a foam pad and things like that to challenge yourself. This is the way you kind of come up into your hip sequencing for stability drills and the mobility drills. If somebody is not firing their hip extension, the glutes, I'm not going to straight away start from the top. I would go to the primitive patterns first and then build up from there. That is my style anyway. Different therapists, different healthcare practitioners will approach it differently, but this is kind of, there is no orthopedics without neurology, right? It's all interconnected, and that is how you do the patterning for those exercises. So these are the things we usually kind of approach the hip problems, and assessment is another big thing where we do it, like kind of find out the root cause of the problem and then deal with it. That concludes kind of this episode. Now we're going to go through a couple of questions came from the audience, and we're going to answer those questions. So we have a couple of questions from our audience for Ask Giri, the Physio Show. So we're going to answer those questions. Anu is going to ask me those questions, then we will go from there.
So the very first question is from Dan from Edmonton. He is asking that he does foam rolling daily for his back, hip, and IT band. And he wants to know, is it good or how it affects him?
Foam rolling. Yeah, foam rolling is a bit overrated in my perspective. And people usually foam roll quite a bit in their back and glutes and IT band. It's okay if you have some triggers to desensitize the triggers, but sometimes you have to ask yourself, why my muscles are stiff? Who's not working so that this guy is working too much? Who's not moving so this guy is moving too much or moving less? And you have to sometimes correct that to the root cause than foam rolling the heck out of the muscle. And also especially sometimes IT band, it's a tight facial band. It's not even a muscle, right? It's a really taut band. And sometimes those bands, because of biomechanical dysfunctions and asymmetries and improper firing patterns, get very tight and stuck to your other tissues. It blends into your quadriceps on the top and hamstrings in the bottom, and it goes down all the way to your knee, attached, blends into your capsule of the knee. So sometimes these tissues need some distraction rather than compression. So instead of you going on the foam roller and just roll the heck out of it, sometimes you need some distraction techniques like cupping and other things to maintain the tissue integrity and the gliding and sliding movements. So the answer for you is, again, you can foam roll if you have some trigger points, you want to desensitize a little bit in the muscles, but do not put compression forces all the time to all the muscles. It's not a great way to approach it. Again, you consult your physiotherapist or healthcare practitioners for the proper advice for that as well.
So the next question is from Sylvia from Ladue.
Okay.
And she is saying that she has a bursitis on her right hip, and she has done corticosteroids injections and painkillers and everything, and it's still recurring.
Okay.
She wants to know, why is that?
Okay. A lot of times we do have patients coming into the clinic with a diagnosis of ischial bursitis. You got this bony prominence on the side of your hip. It's called graded trochanter. I said ischial, that's not right. Trochanteric bursitis. Sometimes you can also ask ischial bursitis. That's not as common as trochanteric bursitis, the big projection of the bone on the side of the hip. So if somebody is getting recurrently and it's not going away, and with painkillers and corticosteroid injections, you have to ask yourself why. Because you think it's a local, just a bursa problem, and I don't think so. Because there are few muscle attachments in the graded trochanter. They are being overloaded or working too much to irritate that area to develop the bursitis in that area. Unless you have a direct trauma in that area, you fell on the hip or somebody hit you with a baseball bat or anything, unless the local trauma is involved, there's always a biomechanical dysfunction or overloading happening or repetitive stress happening in that area. So you have to have a proper assessment, hip assessment or the full body assessment to see why that part of your body is being overloaded, who's not working very well. Is your thoracic spine is rotating very well? Is your lower back is functioning very well? Is your core muscles are integrated very well with your hip movements? Your sacral movements are good. Your loading pattern is good. Are you dropping your pelvis in your single leg standing? Do you have a Trendelenburg gait? Your gluteus medius is working. If your hip stability is working. All these things have to be checked to know who is putting the stress on the bursa, to irritate the bursa. That is the right approach instead of putting the ultrasound on the bursa or putting the corticosteroid and everything to solving that problem again and again. You're beating around the bush. You're not looking at the cause of the problem. You're just chasing the symptoms. Chasing the pain, you won't get very far. You need to get into the problem. Thanks. Those were some great questions, Anu. That kind of comes to the conclusion of this third episode of Ask Giri, the Physio Show. How hip is your hip? So if you like this, if this will help some of your friends and family members, please feel free to share it, like and subscribe our YouTube channel, and also go check out in the Facebook. All our episodes are listed in our Facebook page and also in the YouTube page for Ask Giri, the Physio Show. If you have any questions which needs to be addressed or asked, please email me at giri@physioshow.ca. And I wish you guys the rest of the summer the best way possible and keep moving your hips. Bye. See you in the next episode.